Have you ever sat alone at night, feeling the quiet pressing in on all sides, wondering when the best parts of being a man started slipping away? Do you find yourself struggling with concerns that no one ever warned you about? Questions about prostate health, intimacy, urination, confidence? The private topics rarely discussed even with close friends. If so, you are not alone. In fact, you are part of a quiet, unspoken story shared by millions of men across Europe. Men from bustling Berlin streets, Parisian cafes, the sleepy villages of Austria, Spain's sunny coast, Danish harbors, all bound by the same confusion, frustration, and silent hope for something better. My name is Dr. Lauren Pierce. I am a licensed European urologist with practices in Vienna and Milan, author of dozens of peer-reviewed papers on male health, prostate care, and sexual medicine, and a lifelong believer in honest, science-based, empathetic guidance for men at every age. Tonight, I want to invite you on a deeply personal, highly practical journey. A 2-hour exploration of modern men's health for those over 60, covering everything from cellular changes in the prostate to hormonal shifts, pelvic floor dynamics, medicine, surgery, physiotherapy, and holistic, everyday strategies for pleasure and empowerment. This is the uncompromising truth, grounded in experience, research, and the lives of real European men. Let us start with a challenge. Why do so many men expect to keep the same patterns, the same techniques, and the same confidence in sexual and urinary function as they enjoyed in their 20s and 30s? Despite decades of androgens, environmental stress, and age-related changes in anatomy and physiology? Because we were taught, by older generations, by media, sometimes even by health professionals, that if it ain't broke, don't fix it. Or worse, that talking about sexual wellness past retirement is embarrassing or selfish. But I'm here to tell you, it is not only your right, but your responsibility to learn, to adapt, to become your own health advocate, so that you may enjoy a decade, 2 decades, even 3 decades more of meaningful, safe, and satisfying intimacy. Let's break the silence. Let's pull back the curtain on every myth, every misconception. From, you must masturbate frequently to avoid illness, to, nothing can be done after a certain age. Or the most harmful of all, my problems mean I am less of a man. As we journey through the next 2 hours, I will tell you the truth behind each myth, explain the biological and neurological facts, share the stories of men like George from Germany, Jean from France, Peter from Denmark, Hans from the Netherlands, Klaus from Switzerland, Luciano from Italy, and many others who faced the same fears, the same setbacks, and overcame them. Let's begin at the cellular level. The prostate, a small gland just below the bladder, is central to the male reproductive and urinary systems. It produces seminal fluid, controls part of orgasmic sensation, and, due to its location, can directly affect urination, urinary urgency, even sleep quality. From our late 40s on, almost every man experiences benign prostatic hyperplasia, BPH, the gradual, non-cancerous enlargement of this gland. This is not your fault. It is programmed in your DNA, driven by hormonal changes, particularly dihydrotestosterone, DHT, and influenced by lifestyle, diet, and even your sleep hygiene. With BPH, the prostate compresses the urethra, the tube through which urine passes, creating symptoms which can be subtle at first but escalate with time. Hesitancy to urinate, a weak stream, a sense of incomplete emptying, frequent nighttime awakenings, nocturia, and very often a growing sense of frustration and loss of intimacy. I want you to picture the life of Giorgio, an Italian painter from Florence. Once he prided himself on stamina and careful creative approaches in the studio and the bedroom. But after his 63rd birthday, Giorgio noticed lingering discomfort after masturbation, dribbling episodes, sensation of pressure in the pelvis, and a loss of what he cherished most, deep, full-bodied pleasure. Why did this happen? Because like so many European men, Giorgio kept using what once worked: firm grip, intense rhythmic movement, rushing towards climax, which with time led to microtraumas in the periurethral tissues, chronic pelvic tension, and aggravated prostatic inflammation. Let's dig into the physiology. The nervous system, composed of the pudendal and pelvic nerves, changes with age. Erogenous receptors, Pacinian corpuscles, Meissner's corpuscles, become less sensitive under constant monotonous stimulation. Instead of receiving bright, intense signals that trigger arousal and pleasure, the nervous system adapts, requiring ever stronger stimuli for diminishing returns. Medical textbooks call this sensory accommodation, or desensitization. At a certain point, this can lead to a cycle of frustration, stronger pressure, even rougher touch, yet weaker sensations and less satisfaction. Scientifically, we now know that gentle, mindful, and varied stimulation, as well as regular periods of rest, help preserve the body's capacity for pleasure and protect against nerve and vascular fatigue. Let me share another story. Peter, an architect from Denmark, was referred to my Vienna clinic by his general practitioner. He was embarrassed to admit that after decades of doing things the same way, he had lost the ability to climax. His erections had softened. His urination was slow and unsatisfying. His spouse, Ingrid, felt distant, helpless. "It's like my body forgot how to respond," he said. His was not an isolated case. Nearly 50% of men over 65 in our European Men's Health Registry report some combination of difficulty urinating, reduced orgasmic satisfaction, loss of erectile rigidity, pelvic or perineal pain, soreness or burning after climax. Now let's pause for a moment. Breathe. These symptoms are not an end, but a signal that the body needs a new approach, one that is both more gentle and more scientific. Clinical research across France, Germany, Austria, and Italy is transforming men's care. Urology and sexual medicine clinics now offer personalized plans encompassing medical diagnostics, targeted medication, physiotherapy, psychotherapy, and lifestyle adjustments. Here are the most effective, evidence-based interventions available today and how you can implement them. Comprehensive urological evaluation. Begin with a visit to a licensed urologist, ideally one specializing in andrology or men's health. Your exam may include a digital rectal exam, DRE, prostate-specific antigen, PSA, blood test, ultrasound imaging, uroflowmetry, which measures urine flow rate, and symptom questionnaires like the International Prostate Symptom Score, IPSS. These tests distinguish benign issues, BPH, CPPS, from more serious conditions, prostate cancer, urethral strictures, chronic infections. Early diagnosis allows for precise, tailored care. Medication and hormonal management, alpha blockers, tamsulosin, alfuzosin, relax the smooth muscle fibers in the prostate and bladder neck, rapidly alleviating urinary obstruction. 5 alpha reductase inhibitors, finasteride, dutasteride, Reduce DHT, shrinking the prostate and slowing progression of BPH. Phosphodiesterase 5 inhibitors, tadalafil, vardenafil, not only improve erectile function, but also enhance LUTs and pelvic vascularity. Hormone optimization, guided by blood tests, can include careful management of testosterone, estradiol, DHEA, and SHBG. Physiotherapy for male pelvic health. Specialized pelvic floor physical therapists are increasingly accessible throughout Europe. They teach a customized regimen of pelvic floor muscle training. Gentle, slow Kegel exercises focusing on both contraction to enhance orgasmic control and relaxation to prevent chronic tension. Biofeedback sessions, where sensors help you see and control muscle engagement. Myofascial release, targeting trigger points of pain in the pelvic floor, perineum, gluteals, and thighs. Relaxation breathing, diaphragmatic, paced, which reduces hypertonicity in the pelvic region. Modern device therapies, low-intensity extracorporeal shockwave therapy, LI-ESWT, uses pulses of energy to trigger neovascularization, growth of new blood vessels, restore nerve responsiveness, and improve both urinary and sexual parameters. High-frequency perineal vibration, via personal or clinical devices, relieves congestion, enhances circulation, and is proven effective in double-blind trials for persistent pelvic pain. Vacuum erection devices, penile pumps, especially when used under medical supervision, can safely stimulate blood flow and stretch connective tissue, offering additional support for erectile function in men with vascular disease. Nutritional and lifestyle foundations, Mediterranean-style nutrition, rich in olive oil, fish, leafy greens, legumes, nuts, omega-3s, and antioxidant-rich berries, is repeatedly shown to lower inflammation and support healthy hormone production. Limit intake of saturated fats, processed meats, and excessive alcohol, each of which can promote inflammation in the genitourinary system. Prioritize moderate aerobic exercise, cycling, brisk walking, swimming, and resistance training. Mindfulness and stress reduction, meditation, yoga, guided breathing, lower stress hormones that worsen LUTs and sexual dysfunction. Let's get practical. What step-by-step protocols do I teach my patients, European men just like you, from Oslo to Barcelona? A. The gentle self-care protocol, recommended for daily or alternate day practice. Prepare a warm, quiet space. Minimize distractions. Turn off your phone, dim the lights. Consider soft music. Begin with 3 to 5 minutes of slow belly breathing. Place a hand on your lower abdomen. Breathe deeply. Feel your muscles relax with each exhale. Apply a small amount of lubricant, water-based or natural oil such as coconut or almond, to your hand. Hold the penis gently, not tightly. Let your grip be light, almost as though cradling something fragile. Use slow, deliberate movements along the length of the shaft. Avoid repetitive, high-friction stimulation. Focus your attention on the perineum, the area between the scrotum and anus. With your other hand, apply gentle circular pressure for intervals of 10 to 30 seconds. This encourages prostatic blood flow. As you feel arousal build toward climax, pause and breathe for at least 20 seconds. Let the urge subside, then slowly begin again, the edging technique. Repeat 2 to 4 times before allowing yourself to finish. B. Aftercare. After orgasm, remain still and continue gentle breathing for 2 to 3 minutes. If you notice any soreness or tenderness, apply a warm compress to the pelvic area or try gentle stretching of the hips and thighs. Drink a glass of water. Hydration aids prostatic and urinary health. C. Daily pelvic floor routine. 10-15 minutes, best done mornings and evenings. 5 slow Kegel holds. Tighten the muscles used to stop urine flow. Hold for 5 to 8 seconds, then release. 5 reverse Kegels. Imagine relaxing your pelvic floor so that your pelvic region bulges out. Hold for 5-8 seconds, then release. Gentle, happy baby pose. Lie on your back, bring knees to chest, hold shins or feet, and gently rock side to side for 1-2 minutes. Let's revisit Hans from the Netherlands. After 6 months integrating urology-directed medications, dietary adjustments, regular physiotherapy, and these self-care routines, not only did his nocturia resolve, but his sexual pleasure returned, with a richness and depth I last felt in my 30s. Hans and his partner took up partnered stretching and perineal massage, which deepened their sense of trust and emotional connection. Luciano from Milan, once plagued by anxiety and constant feelings of pressure in the perineum, benefited most from cognitive behavioral therapy, CBT, focused on sexual self-image, and the support of a men's support group, meeting weekly to share experiences, progress, and setbacks. Clinical evidence overwhelmingly supports this multidimensional approach. A 2024 meta-analysis analyzing 3,500 European men with moderate to severe LUTs and sexual dysfunction found that those combining medication, physiotherapy, structured self-care, and nutritional improvements enjoyed double the improvement on the International Index of Erectile Function, IIF, and IPSS, over those using medication alone. Men using regular perineal and pelvic floor relaxation reported up to 60% less post-orgasmic pelvic discomfort. Daily aerobic exercise, at least 30 minutes, lowers overall risk for prostate surgery by 35% and supports testosterone production for libido and mood. Now, let's talk about emotional well-being, because no matter how advanced our pharmacology or techniques, the experience of sexual trouble, urinary symptoms, or chronic pain is also an emotional journey. Older men, especially in Europe's Stoic cultures, often feel shame or inadequacy for needing help, or for not functioning like they did before. This is a dangerous, outdated myth. Modern andrology recognizes that adaptation, not resistance, is key. Come to see yourself as a wise new beginner, curious, open, and self-compassionate. Develop a progress journal to track your sensations, climaxes, symptoms, and emotional ups and downs. Try reframing setbacks as discovery. Each strange new feeling is a sign of learning, your body's way of saying, "You're finally listening." Connect with support networks, either locally or online. There are confidential, physician-supported forums in every major European language. Don't hide this journey from your partner. Invite them to learn and adapt with you. In the final half hour, let's address frequent advanced questions from my patients. Should I ever stop all stimulation? Rarely, unless advised by your physician, in cases of active infection, injury, or surgery. Total abstinence is not generally healthier. Balanced, mindful engagement is. Is it safe to use vibrational or mechanical aids? Yes, when chosen carefully. Look for CE-certified European medical devices. Use only as directed, avoid excessive intensity, and communicate openly with your urologist. What if I need surgery? Modern, minimally invasive urological procedures, Resum steam therapy, HoLEP laser enucleation, UroLift implants, can now resolve obstructive BPH with low risk, rapid recovery, and excellent preservation of sexual function. Always seek a second opinion and choose experienced, board-certified surgeons. Will testosterone supplementation help? Only if indicated after full hormone panel testing under medical supervision. DIY hormone use is unsafe and unreliable. Does prostate cancer mean no more sex? Absolutely not. Most localized cancers are managed with radiation, prostatectomy, or active surveillance. Sexual adaptation is almost always possible with professional guidance and rehab. Finally, do not overlook joy. Pleasure is foundational, not optional. Enjoyment of one's body, connection to a partner, curiosity, and the willingness to learn. These are as vital to your health as any drug or therapy. If you remember nothing else, remember this. With science, patience, and self-compassion, you can adapt, thrive, and enjoy deeply satisfying sexual and urinary health well into your 70s, 80s, and beyond. I am Dr. Lauren Pierce. You are not alone on this journey. Join me and thousands of European men in crafting a new story, one of hope, dignity, and lifelong discovery. If you found this story insightful, please subscribe, share your experience or questions, and reach out to our online community. Together, we're rewriting what it means to be a man, at every age. Thank you for trusting me with your story. Let this be the beginning, not the end, of your healing and transformation.